Did you know that obesity isn't just about eating too much or exercising too little? It's a complex medical condition that involves genetics, hormones, and even mental health. Yet, so many people are still stuck in the cycle of fad diets and quick fixes that we know don't work. So in this video, we're going to be diving into the science behind obesity medicine, what it is, why it's different from traditional weight loss approaches, and how it's transforming lives. By the end of this series, you will have a whole new perspective on what it takes to achieve sustainable weight loss management. Let's start with the basics. What is obesity medicine is a specialized field of healthcare that focuses on understanding and treating obesity as a complex medical condition, not just a cosmetic issue or an issue of diet and exercise. Because my first key point that I want to emphasize is that it's not just about willpower. It's influenced by so many factors, right? By genetics, hormones, and even your environment. Also, look at hormones like ghrelin and leptin that control hunger and satiety. And when they're out of balance, it's hard to lose weight. Obesity medicine is a holistic approach that combines medical treatment with medications, surgery, lifestyle changes, mental health support, and personalized care plans. No one size fits all here. Most importantly, it moves away from the stigma of just eat less and move more, because if it worked, then why are we 80% overweight or obese here in the United States? Instead, let's focus on evidence-based strategies tailored to the individual patient. We need to look at factors that influence obesity, from genetics, hormones, mental health, the environment, and even cultural practices, right? We celebrate around food, we cry around food, we bring food to funerals, right? We need to change that relationship, which I'll get into later. First, let's dive into the science behind obesity. It isn't just about calories in versus calories out, much more complex than that. So let's hop into the hormonal factors that we talked about a little earlier, which was leptin. Leptin is often called the satiety hormone, right? When it functions properly, it tells your brain that you're full. But in people with obesity, you've got resistance to leptin, making it harder to feel satisfied after eating. And then on the flip side, we've got ghrelin. That's your hunger hormone that tells your body to eat. Higher levels happen in obese patients. That makes it hard to stick to a diet. Did you know there's over 100 genes that have been linked to obesity? These genes affect everything from how your body stores fat to how your brain processes hunger signals. The next one we're getting into is mental health. Stress and emotional eating are often overlooked factors in obesity. Chronic stress raises cortisol, which then leads to fat storage, especially around the belly area. So it's true what they say about stress is a killer. I want to talk about why obesity medicine matters both to the clinician and to the patient, because traditional weight loss of eat less, move more doesn't address the underlying issues. And then for the impact on the patients, the obesity can lead them to have chronic diseases, diabetes, heart disease, and even certain cancers, especially osteoarthritis, which every pound you gain puts 4 pounds on your joints. Treating obesity more effectively can prevent or even reverse these conditions, like prediabetes and insulin resistance can be reversed versus diabetes. As healthcare providers, we have the responsibility to offer evidence-based solutions that go well beyond the outdated advice that we've been giving over these decades, because as more evidence come in, it shows that we need to treat the systemic condition and not just the symptom. I can tell you that a patient comes in and they said, "You didn't just help me lose pounds, you gave me my life back." That made me feel amazing, and that lets me know that I'm doing the right things. I want to bust some myths about obesity. You can share these with your patients, or maybe some of these you didn't even know, and that's okay. That's why we're here. And as we discussed, that factors like hormones and genetics play a huge role. So it's not simply about self-control, it's about biology. So self-control alone isn't enough. Myth number 2, diets alone are enough. No. Research shows that restrictive diets often fail long-term because they don't address underlying issues like hormonal imbalances or emotional eating. So we've got to treat the whole patient. Myth number 3, exercise is the key to lose weight. Wrong. While exercise is important, it helps with cardiovascular health and overall health in general. Study shows that diet has much greater impact on weight loss than exercise alone. Tell them resistance training, which will help preserve that muscle that can be lost due to atrophy as you're losing weight. Obesity medicine is changing. It's changing lives by addressing the root causes of weight gain rather than just treating symptoms. It's a field that combines science with empathy. And it's just one of the things that I'm so passionate about. I have personally lost over 120 pounds myself, and I still struggle. In our next episode, we're going to dig deeper into cutting-edge treatments and medicines like medications, GLP-1s, 2-in-1s, retatrutide, things that are coming out. So make sure you subscribe. Don't forget to turn on that bell because you don't want to miss it, right? This series is going to be amazing. And if you found this video helpful, please help me give me a thumbs up. Share with someone who might benefit from understanding this topic better. I'm still learning, so let me know what questions or comments you have. Drop them below, and I'd love to answer them in the future videos. And as always, I've been Shane Grindle, and may the force be with you.